Let's talk about insurance and breast reductions. Do you have to be a certain size to have insurance cover your surgery? The not so simple answer is yes for most patients, but there's a few circumstances where you don't. With most insurance companies, they go off of just almost entirely Schnur criteria. This is an example of a Schnur scale. Every insurer has a similar scale. This is the one from my website. Your plastic surgeon will put your height and weight in a calculation and determine your body surface area. That's this number right here. And then right next to it on the scale will be how much tissue we need to remove from each side. This calculation is in grams, because in medicine we use grams and kilograms, not pounds or ounces. And you can figure out how much needs to be removed. And for reference, 500 grams is about 1 pound. Now, insurers used to have all kinds of other criteria, but in the last 10 years or more, I really haven't seen any of this stuff be required. It's just purely, do you meet this number? And it is unfortunate because there's been multiple studies now that have shown that breast reduction has significant benefits, even if you don't meet that number. But unfortunately, that's the insurance industry standard, and that's what they require. There's two situations where you may not have to meet Schnur and still get your breast reduction covered. The first situation is if you have breast cancer. One of the ways we treat breast cancer patients is with a lumpectomy, where we take a piece of tissue out with the cancer in the middle of it. Now, sometimes if the lumpectomy is going to be relatively large, this can distort your breast, and you can have a plastic surgeon do a breast reduction on both sides in order to give you symmetry and fix any contour deformity that may result from the lumpectomy. In this situation, the amount of grams that we remove doesn't matter. Now, the other situation, which is a little bit more rare, is for patients that have congenital deformities of their breast, like tuberous breast deformity. So I've had patients that a breast reduction was covered for treatment of their tuberous breast deformity to improve symmetry and shape, and they did not require a certain number of grams to be removed. So it's not really so much the size you are starting with, it's how much grams can we remove. And it's always important as a patient when you're considering having a breast reduction and you're looking at insurance coverage, just because you can doesn't always mean you should. So you should always talk with your surgeon. It's not just can you remove as much as the insurance company wants, is that going to translate into a size that makes you happy and is a proportion that makes you happy? So that's always an important part of the conversation too.